Okay, well, good afternoon or evening, everyone. Really appreciate the participation with regards to the launch, the first kidney talk that we are doing from the New Mexico Kidney Foundation during National Kidney Month. So if you haven't been greeted, well, this is National Kidney Month, March, and March 10th is National Kidney Day. As it happens, Leonda and I will be on the KRQE TV channel, their morning show, to talk about National Kidney Day and Month and the various activities that the New Mexico Kidney Foundation will be doing. And I would like to just take a moment to highlight some of the activities that we're launching this month in recognition of National Kidney Month. In addition to this kidney talk, Dr. Barrantes will be doing another one on March 16th. So we'll be sending out the advertisement for that after today, so tomorrow. And so be looking for that. That's at Wednesday as well. So we're doing two kidney talks. And that kidney talk on the 16th will be focused on, what am I doing that might affect my kidneys? So that should be very interesting as well. Two other things I wanted to bring to your attention coming up pretty quickly here. On March 12th, in collaboration with the Albuquerque Pickleball Club, we'll be having a tournament to benefit the New Mexico Kidney Foundation at the Manzano Mesa pickleball courts. And so if you'd like to know more about that, or to register to participate in the tournament, or to donate to the Kidney Foundation for that tournament, please text the word play, as in playing, PLAY, to 505-370-7123. And then we are also very pleased to announce the launching of a support group for kidney patients and their families and caregivers. Our first meeting of that group we are targeting for March 28th. It's going to be in the evening at 5:30. We're going to be doing it virtually. And what we'd like you to do, if you're interested in that, we have that posted on our social media. So you can look there at NMKidney, or we will be asking everyone who'd like to participate in that to go ahead and email us at our information. So info@nmkidney.org email address. And if you'd like more information on that, just include it in the chat and we can provide that to you directly. And then
And it's free.
And that's, yes, I would like to know that's free. There's no, dues or anything of that nature. Very good. Yeah, Leonda's spearheading this. She's done a lot of research. And is there anything else you'd like to say about that? I'm just touched on a cursory.
My baby, so I want it to go well.
Yes, well, it will go well.
Yes,
And then
just
we
need to stop in and just, and don't be intimidated. We're all there to talk and get to know each other and find out how we can provide support as a community and find out what the needs are in our community. So I'm very excited about this. So I look forward to seeing you all there on the 28th.
And it'll be facilitated by us, but it's not geared towards, we aren't going to have medical professionals providing advice. It's there to share experiences, knowledge that, those of you as patients or as family members, or, who might know someone who has kidney disease, to be able to interact and share information and to, as the name implies, to support one another. So that's happening. And then what am I forgetting? Oh, not least, and although last, we have launched a competition for middle and high school students to do a project, whether it's a poster or some kind of a media, whether like TikTok or Facebook or YouTube, to help educate and make others, particularly their peers, aware of kidney disease and how to prevent it. And so we just launched that campaign. It'll go till the end of the month. We'll be receiving entries from that, and there's more information. If you'd like to have, if you know anybody, a student or a teacher, again, this is geared towards middle and high school students, please go ahead and have them text the word educate to our text number 505-370-7123, or go to our webpage at www.nmkidney.org, and you'll find all the information there, the entry form, the permission slips, the instructions. So we're really hoping that the students will be creative, use their young knowledge to be able to produce something that would be relatable to their peers, but also help us in our effort to reach out to those generations with regards to kidney disease.
And everything
Go ahead.
on the website. So everything is, on the Facebook. So you've gone through so much, and we're so packed with activities this month that any kind of questions you have, they'll be on Facebook too. We've made sure and posted that on Facebook. So
excellent. Precisely. It's all there on Facebook. It's also on our webpage. So go to either of those sites and you'll see all this information. And finally, I would note, in recognition of National Kidney Month, we're also launching a special campaign for raising funds for the work that we're doing. We're hoping to expand our assistance to patients needing care in order to get onto the transplant list. So we've targeted some funding amounts to help with that work. Also some funding to expand our awareness and education efforts throughout the state, interacting. So if you text the word kidney to our number at 505-370-7123, or again, go to our webpage. You'll see the donate button on there in honor of National Kidney Month. So please feel free to visit that. And we'll also be posting that on our social media here later this week. So we're really hoping to be able to do good work in helping those who need assistance with regards to kidney transplant, kidney treatment, as well as really trying to make some inroads with some targeted populations, those who are at higher risk of getting kidney disease, and for the younger generations to really advance our efforts to prevent kidney disease to begin with. So we're doing that. So that out of the way, thank you very much for participating in this event, our Kidney Talk for March. And really pleased to have our board president, Dr. Fidel Barrantes, to be talking to us about this fundamental question. Could I have kidney disease and not know it? And it's interesting, the statistics there, that approximately, according to the Center for Disease Control, 1 in 7 Americans have kidney disease. And it also says that about 90% of those probably don't even realize they have it. So hope to hear some more here and gain some insights from Dr. Barrantes. I really appreciate all of you joining us. And Dr. Barrantes, I'm going to turn it over to you.
Thank you very much, Tim. How is the audio there? Can you hear me well? Tim, can you hear me?
Yeah, I think everyone can hear you fine.
Very good. Excellent. Okay, perfect. So thank you again for the introduction. So I wanted to spend some time in the next few minutes talking about what is chronic kidney disease. And that's a term that has been used very frequently to label kidney disease, and sometimes used very loosely, sometimes used with some fear. So I'm here to kind of dispel some myths and also explain a little bit more what is chronic kidney disease. What are the steps that you can take if you are told you have chronic kidney disease? So what we're going to learn in the next few minutes is the definition, how doctors diagnose CKD. The other term is also called CKD. We're going to learn if all CKD is the same or if there are the stages. What symptoms can I have when people have CKD? Those are the important things that we want to understand more. And we want to learn also what does CKD means for the patient, for their health, for their families, and also for in the lives. So what CKD how can CKD can change somebody's life? When a person needs to see a kidney specialist, and the CKD means you need to have a new kidney or or go on dialysis. So those are the questions I wanted to discuss, and I wanted to present my experience and my point of view. And at the end of this presentation, we're going to discuss any question that you may have. So in general, the society is defined, the American Society and also international societies of kidney doctors define chronic kidney disease as an abnormality, something that is not normal, abnormality in kidney function or a structure that is there for at least 3 months. It has to be at least for 3 months to be called CKD, and it has to have some implications in the health of the individual. So when I say kidney function is, for example, we measure some different blood tests for the kidney function. That's the way we see an abnormality. We can see changes in ultrasound of the kidneys, or we can see changes, for example, in a kidney biopsy. So those are changes in the structure. So we see changes in blood tests or changes in the structure that should be present for at least 3 months to be called CKD. And the CKD can be classified, according to the cause. Well, what was the origin of CKD? Was it diabetes related? Was high blood pressure related? Was perhaps age? Perhaps some history of cardiac problems? So what led to CKD? And then we're going to use a very, very familiar term that you may be familiar already. It's called GFR. The GFR is basically a term that we use to more or less assign what is the percentage of kidney function. And to calculate the GFR, we use a blood test called creatinine. Creatinine is a marker. It's one of the byproducts that we generate as part of our metabolism. It's produced by the liver sometimes. It's also produced by the muscle cells. And every day we make this creatinine. And the creatinine as a waste product is eliminated by the kidney. When the creatinine levels goes higher in the blood test, that means that the kidney is not getting rid of it. And that will alert the doctors to something is wrong with the kidneys. So the creatinine values in the blood are going to be used along with other parameters to calculate the GFR. The GFR is a formula that includes the creatinine as one of the factors to calculate the number. And we also look at the protein in the urine. That's one of the easiest ways to understand the health of the kidneys, just by looking at the urine. Does the urine has any protein, any blood, any specific cells that are abnormal? Those are things that we are looking into it. So this is a very simple example that I want to show you. On your left side of your screen, you have a normal, and then on the right side you have CKD. This is a picture of a kidney biopsy, the one in the top. You see if you focus on the first picture, on the bottom part, on the bottom left part, on the bottom left side, you see a round structure there. That's a filtering unit. That's called glomeruli. That's where the filtration process happens. And then whatever we don't need goes to this system of pipes that you see next to it of this unit. This is a normal kidney. This is the way it should look. And if you change your eyesight to the next picture, the one in bluish looking, you see the unit, the glomeruli, looks quite different, and all the structure of the tubules, these little round things that you saw in the normal structure, are no longer present. Those are the changes that you see with CKD, with chronic kidney disease. So essentially, there is a destruction of the normal architecture of the kidney. So the kidney has an order, has a way how things are arrayed and organized, But with CKD, that get destroyed, that get altered, and then the kidney is unable to do its regular function, get rid of the toxins, work as a very sophisticated colander or a filter. So the kidney is unable to do that. If we look at an ultrasound, you go in the picture below, and the normal you see a structure looking like a giant bean. You see like a big bean there with some. It's kind of it's in a horizontal position, and you have on the CKD part, they have the same structure, but you see the color is different. In the left side, the kidney color is kind of darker, and it's kind of a little bit more pumpy, more has more wider cortex. On the right side, you see it's much more pale, more whitish looking. That's a sick kidney. That's the images of a kidney with a CKD. So there's another way that doctors can look, radiologists can look at the differences between a normal looking kidney and a kidney with CKD. So those are the structural changes that we see with a normal kidney or a CKD. So how doctors think that I may have CKD? Well, I think it has to do a lot with, we investigate more into the family history. Whenever you go to a physician, you're many times asked, so what is your family history? What is your mom's or dad's disease, your brothers, sisters, uncles? And we learn from those because there are many diseases that have some genetic traits, and we learn some risks that are shared among family members. We also ask for lifestyle, how active you are, what are your food habits like? Do you smoke? Do you drink? So those things help us we call risk factors, help us to put together an idea whether a patient has a specific risk factor that can increase risk for CKD. We ask about medical history. Do you have heart disease? Do you have diabetes, high blood pressure? Or have you been taking any medication that we know they cause kidney disease, like for example, NSAIDs, medication like ibuprofen, Motrin, Aleve, any anti-inflammatory medications. So those are called, this is medication history, family history, and personal medical history. All these things help us to make a decision or understand whether ordering a blood test to identify a patient that may or may not have CKD is important. So those clues help the providers to order some blood tests for CKD screening. And how physicians or how nurse practitioners or physician assistants learn about CKD in the patients. Once they order this blood test, they order creatinine, they order cysteine. Those are blood tests that measure kidney function. Urine test, imaging, and sometimes renal tissues available through renal biopsies. So those are pieces of data that we put together to understand whether the patient has or no chronic kidney disease. So once we know we have chronic kidney disease, so is all CKD the same? No, the answer is not. CKD is a wide spectrum. CKD is not a specific disease. It's like a huge bag that is caused by different diseases, diabetes or hypertension or a combination of both, or different things can cause CKD. CKD is just like a general term, and you can grade it, from mild to severe. And the KDIGO, which is an international organization of kidney physicians, they have come up with a classification that I wanted to share with you so you can understand more about the terms. And remember I talked about the GFR? The GFR is sort of the the formula that uses the creatinine value. So based on the GFR value, we can differentiate the different grades of CKD. Now, for example, here, if the GFR, I want you to concentrate on only on the left side of the picture. You may read there, prognosis of CKD by GFR and albuminuria categories, KDIGO 2012. So you see there, GFR more than 90, GFR 60 to 89 in the in the third column, and then 45 to 59, 30 to 44. You see, as the numbers go down, the disease or the CKD becomes much more severe. So a normal GFR, which is a GFR more than 90, is normal. Mildly decreased is from 60 to 89. 45 to 59 is called mildly to moderate decreased. And typically, we call chronic kidney disease anything below 60. CKD in general is below 60. So 45 to 59 is mild to moderate. 30 to 44 is moderate to severe decrease. 15 to 29 is severe decrease, and less than 15 is kidney failure. So that are the stages. So obviously, as the CKD is more severe, patients are going to start having more symptoms. Patients, whose GFR is more than 90, 60 to 89, 45 and above, they won't have any symptoms at all. So the CKD manifestations is completely different when somebody has a GFR of more than 45 compared with somebody who has a GFR of less than 15. That's completely two different cases. We can also classify further the CKD based on the albumin in the urine, and that's called albuminuria. It's just fancy term that doctors use. It basically helps us to quantify how much protein there is in the urine, how much specific of albumin is the urine. And we can classify as A1, A2, and A3. As the number becomes much higher, the amount of protein in the urine is worse. And we do not want to see too much protein in the urine, because the more protein in the urine usually goes with more advanced disease and more rapid progression of the chronic kidney disease. So we want to have the least amount of protein or no protein in the urine. That's the goal. But if you have much more protein in the urine, we want to hold that, we want to decrease as much as possible. And then you can see, when you intersect the GFR and the albumin, you see those patients who have the more protein in the urine, which is like an A3 column, and with those who have a GFR below 30, the intersection of both groups, you see, these are the red squares or the red rectangles. Those are the patients that we need to be more careful about. Those are the patients who are going to have more symptoms. Those are the patients you're going to have more likelihood of complications in the future. But those are the patients that you want to be on top of things. The other majority of patients, the ones who are in the green or the yellow or dark yellow, so those are the patients whose risk is much less, but nevertheless, they need to be aware to make some lifestyle changes. So again, not all CKD is the same. You see, if someone have told you, oh, you have CKD, so the next question you should ask, okay, so where is my stage? Do I have protein in the urine or no? And how much is it? So those are things that you want to learn as a patient to understand more about what is your risk and how you can tackle the risks. So we're going to go to the next one. So, and the other, this is a question that I always get asked: what symptoms can I have with CKD? And I'm going to tell you the truth: nothing. Nothing from mild to moderate disease. So if we go back to this chart, so if you have a GFR of more than 30, so more than 30, and you don't have too much protein in the urine, let's say 30 and A2 and 30 and A1, probably you're not going to have any symptoms. You're going to feel just fine like anybody else, no symptom whatsoever. And that's the scary part, because if patients don't feel different, why they should do things differently? Why do you have to take medication? Why do you have to make some lifestyle changes to prevent other things? Because if you don't feel different, so it's difficult to convince a patient when those things happen. So typically people don't have symptoms. The kidney has an extraordinary capacity to compensate. In previous talks, we discussed that the kidney has about 1 million of each of these filtering units in each kidney. So those units that die off because of the CKD, the others, the remaining, take up the pace, and they start working very hard, and they make up the lost work from the units that have died. So that sort of compensates. Unfortunately, that compensatory mechanism is causing more damage. Those units that has picked up the pace, they're going to get damaged faster, and they're going to die off, and then we're going to keep losing more units gradually. So people in general don't have symptoms. When the CKD is more advanced, I'm talking here GFR less than 25, less than 20, less than 15, then we're going to see here more fatigue, more weakness. We're going to see some GI symptoms, perhaps. Especially GI symptoms happen usually less than 10%, less than 12%, less than 8 or 15% for some patients. You have decreased appetite, loss of appetite, some nausea in the morning, especially in the morning, and sometimes some early vomiting. Patients feel food doesn't taste right. I don't like meat anymore. I don't feel like eating a steak. I have this metallic taste in my mouth. I have a sour sensation. I moved to New Mexico 11 years ago, and I didn't know the term Vasca. So my patients would tell me, I feel like a Vasca, and I was trying to understand what Vasca means. So then I learned about what Vasca actually means. So yes, if people feel like a Vasca, like those things are like a nausea, those things you can see on a sign of kidney disease, advanced kidney disease from the GI perspective. People can have sleep problems. People they have difficulty sleeping. They have trouble concentrating. Things. Sometimes I have patients who are very highly functioning. They are accountants, they are lawyers, they are teachers. I say, look, I have trouble just remembering things. I have trouble doing some executive function activities. So those are subtle signs of kidney disease many times. Dry skin itching is very common in very advanced stages, early on. It typically goes with high phosphorus or high toxins that are on skin. High blood pressure or difficult to control blood pressure because there is more salt retention. There is more difficulty to treat the blood pressure. There is activation of different hormones that also raises the blood pressure. Because there is more salt retention, there is more leg swelling, there is shortness of breath, there are muscle cramps because there are some electrolyte abnormalities. So all these symptoms you can see with more severe chronic kidney disease. You are not going to see change in the urine. So patients always say, doctor, but I'm making great urine. Why my kidneys are failing? the production of urine doesn't have to do anything many times with the chronic kinases. So people lose or people stop making urine when people just go to full kidney failure or near kidney failure. That's a different stage. This is almost at the end. But in general, CKD 3 to 5, the urine production is pretty much average. The urine doesn't change color. Urine is usually similar, like in the similar color, unless patient may have a tumor in the bladder or in the kidneys, then they will have obviously some sort of red urine or any other blood in the urine. But other than that, the urine would not change color. What does CKD mean for me? This is the question I always get asked from my patients, and I think the answer, it depends. Depends what stages the patient is at. Mild to moderate, life is going to go almost like normal. Moderate to severe, it depends. Depends on your personal values. You know, some people want to put the disease aside and just go on with their life and just ignore it. Some people want to educate themselves more. They want to learn more about it. They want to start involved very, very early on. So someone wants to get re-educated and start Googling lab, reading articles and bringing information to the doctors and just learning more about it, being more proactive. So it depends what you value in your life, and then you can sort of add weight to what is important to you. But I do think it's important that one of the minimal steps, I think, is involving lifestyle changes. You know, anyone who has started to have CKD, they should, I think, so be some conscious efforts to think about making changing in diet. Like, for example, lowering the sodium. Anyone who has CKD, and if not otherwise contraindicated, the amount of sodium should be less than 2 grams a day in 24 hours. That should be the recommendation, unless there are other illnesses that prohibits that. Because you want to decrease the work for the kidney, you want to decrease the load to the kidney, and therefore decrease hypertension and swelling and those things. You want to be more physically active. You know, the society recommends about 150 minutes of exercise per week of activity, of more intense activity per week. That's the recommendation for patients with chronic kidney disease, 150 minutes per week. So you want to be more physically active. You want to get up and about and go for, you know, instead of parking the car close to the store, maybe just park a little bit further and just do more walking. Maybe go for a walk. You know, we live in New Mexico. New Mexico has a wonderful weather. Go for walks, and you don't have to become an athlete. You know, just getting off the chair and going for a walk. That's all you need. You know, for the most part. Mental health is important. You know, some patients take it differently, and again, it depends on the stages. It may increase anxiety. It may cause more depression. It may affect self-esteem. You know, depending, you know how you feel in society, how you feel as a person with your family. It will affect perhaps at work. You know, if you have stages 5 or advanced or 4 in the lower end of the 4. You know, it can affect the work. It can affect your performance. You may want to go to part-time. You may want to discuss, you know, with your boss or with your partners, you know, ways of how to accommodate relationships. It can affect your relationship with your family, with your couple, in terms of what's going to happen next. What is the implication for our personal life? So all of these things are important for you to consider. But again, it depends a lot in what the stage the patient is. And as the stages are advanced, those discussions, I think, should be brought up and should be put on the table. And because at some point they are going to be important. At some point they are going to be needed. And it's good to have like a better, clear path of what you think, what you want in terms of decisions. What does CKD mean for my health? Again, it depends on the GFR level. What CKD are we talking about? Are we talking here? Are we talking moderate or more severe? So it involves discussing with the primary care physician. So how my CKD is going to interact with things like hypertension, diabetes, heart disease, liver disease, lung problems, cancer, for example. So or mental illness. So how is it going to interact together? So it's important to the primary care know about this, and also you be knowledgeable about or learn about and discuss with your primary care doctor about it, because there will be an interaction. We have to watch for medication interaction, because some medications that we use for certain illnesses can potentially make things worse for the CKD part. Whereas if we do not do anything about it, if we just leave it completely alone and don't do anything about it, then we are going to we may lose a very golden opportunity to act and make some preventive changes in terms of disease progression. You want to be careful with over-the-counter medications. When the GFR is normal or higher, pretty much people can take pretty much anything. Adlib, Sudafed, or any cold remedies. But with advanced CKD, things changes, because medications can become a bit more toxic, or medication can interact with the CKD physiopathology in itself. That can raise the blood pressure, can make people more confused when they take Benadryl, for example. So things like those are important to understand. So when you have questions, most of the retailers have now a pharmacist, in most of the stores. So it's good practice sometimes, if you have advanced CKD and you're not sure about an over-the-counter medication, bring it to the pharmacist there. Say, can you please educate me or guide me about it? So I think most of the time they're going to be very helpful to inform you whether it would be an appropriate medication or not, or maybe bring it to your primary care doctor. Vaccinations. Vaccination is a very important point that we many times forget. Patients with chronic kidney disease, especially GFR system low, they're a higher risk for complications from things like a flu, pneumonia, and now we have COVID. So you want to be very proactive on vaccines, because the the research has shown over and over and over, people who get the vaccine, and have chronic kidney disease, they are less likely to get more severe illness or to land up in the hospital, in an ICU bed, or getting a severe pneumonia. So there is some protection factor from the vaccine. And remember, as we get CKD more advanced, our immune system is lower, because the kidney is also an organ that acts as an immune system organ. So our immune system gets lower, and therefore we are more prone to have infections. So getting our vaccines, our routinely recommended vaccines, is important. Shingle vaccines for those above 65 years old is important. What does CKD mean for my family? Depends on the state. Earlier stage, perhaps not much of a change. Later stage, yes, it's important, because you want to discuss about lifestyle changes. We talk about changing dietary changes, perhaps cooking more at home, perhaps eating less outside, eating less fast food, perhaps learning how to cook, perhaps cutting staging your vacation trips kind of need to be changed because have to be careful where to go and make sure you plan things accordingly, because if you have CKD5 getting closer to dialysis or kidney replacement, you may want to be more careful where you're going because you want to avoid getting sick abroad. More as the CKD progresses, that means more medical appointments. You want to talk about caregiver support and caregiver burden as well, because both things go hand by hand. People with advanced CKD, they will need more and more support, but also the caregiver is going to get more and more burnouts. So there has to be a mechanism to see how we can help the primary caregiver to take a little break when that will happen. Expenses. Unfortunately, healthcare nowadays is very expensive, and that's the reason we're here as a foundation, is to prevent to go into later stage of CKD, to prevent. So CKD is a very costly disease as it gets in the later stages. So it's important to be mindful about the medical expenses, insurances, mental health. It can be a big factor. I have patients with where anxiety and depression become the driving force many times, and many changes in their lives. Sometimes I have seen even divorces when a CKD diagnosis has happened. So those things happen, and unfortunately are not uncommon. So it's important to be aware of it. When should I see a kidney specialist? I think it's important that first of all, that all of us should have a primary care physician. I know it's very difficult to have one, especially in New Mexico. A lot of our PCPs tend to leave for whatever reason. But when possible, try to get your primary care doctor. So that person will assess your risk factors, will order regular blood tests, and then will determine whether you have or not CKD. So if you were told you have CKD, I think it's important when there is a rapid decline in GFR. Now, if somebody, for example, in 2020 GFR was, let's say, 80, and in 2021 it was 65, in 2022 is 49, or is 50. Even though still more than 45, the rapid decline on GFR is a red flag. So you want to make sure somebody with more expertise in kidney disease look at your case and see what could be happening. When the GFR is below than 45, definitely it's important to see a kidney doctor. When the GFR is below 45. When you have protein in the urine, when the blood pressure is difficult to treat, especially when the GFR is declining, when the GFR is between 45 to 60 with significant protein in the urine, when there is more than 300 grams, 500 grams, 1 gram of protein in the urine, you want to see a kidney specialist. When you see this GFR level and also a lot of white blood cells, a lot of red blood cells in the urine, and there is no UTI history, then you want to see an also specialist. So those are things you want to see a kidney specialist. And the kidney specialist will going to look more into detail about, okay, so what's causing this decline? Let me look at your medication. Let's see what we need to do. Maybe do a kidney biopsy. So they can just start a series of steps that can help us to understand more what is the cause of the CKD. Do I need to go to dialysis or get a new kidney? The answer, most of the time, not. You do not. Most people with CKD do not progress to kidney failure, do not need a new kidney transplant. Most people with CKD, they go on with their lives. However, a small fraction of patients who have more severe CKD, CKD5 or CKD4, GFR below 20, those are the patients that, and if they have a lot of protein in the urine, they are going to perhaps progress faster to kidney failure. A lot of research have shown that people with CKD, stage 3, 3B, GFR 45 to below, they tend to have more like a cardiovascular events. They have like a heart attack or heart failure or a stroke before they reach to dialysis. So that's the important point, the message I want to transmit tonight. You do not want to wait for those things to happen. You want to be proactive. You want to act earlier. So if your GFR is on those parameters, those ranges, you want to ask your primary care doctor, no, do I need to see a cardiologist? Do I need to have a stress test or an echo? Do I need to check my carotids? So those things are important to understand. How is my cholesterol doing? How's my blood sugars doing? So because those risk factors have come together. But most people don't progress to kidney failure. Only a fraction of them does. I think this is what I have for today. I'm going to stop sharing my slide, and I'm going to go back to Tim. Thank you very much.
Excellent. Appreciate that, Dr. Barrantes. If anybody has any questions, please feel free to go ahead and note them in the chat. I know there's a couple items there I'd like to bring up, but while folks are thinking if they have any questions or would like to put anything in there, I had one I wanted to bring up real quick. So I was curious with regards to the GFR and urine. Is that something when you do your annual visit to your doctor and they run those basic tests, are those things checked for when they do the blood test and urine test? Or is that something you would have to ask for if you have any idea or you want to make sure that you might not be tending towards those early stages of kidney disease?
That's a good question, Tim. Those tests are included on a regular panel. It's called chemistry panels or comprehensive chemistry panels. And 99.9% of primary care physicians order those labs on an annual basis as part of regular checkup. And sometimes urine is no order unless the patient has some symptoms. I'm a huge advocate of urine should be ordered. So urine is very simple. It's super inexpensive, but you can discover many illnesses.
Yeah, very good. Okay. So if our primary care, when we go in for our annual visit, doesn't order a urine test, we could probably ask for that as well.
Yeah, you can do that. Yeah. Yes.
Excellent. Some of the statistics, the Center for Disease Control's estimates that 1 in 2 Americans between the ages of 30 and 64 will likely develop kidney disease. And then here, specifically in New Mexico, 60% of kidney disease is caused by diabetes, and an additional 17% is caused by hypertension, high blood pressure. And another statistic, 1.5 times more likely to develop kidney disease. So there are a number of statistics here that really should have us in our state be paying attention to these types of things. And as you mentioned, prevention is the key. Those early stages, if we can catch it, the GFR and the protein, early in those stages, then that goes a long way to preventing it from progressing to those end stages and ultimately kidney failure and dialysis and transplant. So that's really the key objective here. We had one individual, Patrick Bartolomeo, mentioned about, he was told about drinking lots of water. So I thought maybe bring that up and see what your advice is with regards to that as it relates to kidney disease.
That's a very interesting question. So it depends. No, creatine is a marker of kidney function, and it depends a lot on the hydration of the individual. So if a patient goes to a lab after running a marathon and hasn't been drinking, fluid, they're going to be dry, and they're going to have more toxins. So and then therefore their labs may be not reflecting of a normal state. So and that can potentially lead to a false, CKD. And that's when I mentioned that CKD is a term that we use. It has for 3 months. It has to be an abnormality for at least 3 months. It's not an isolated value. So yes, by drinking water, if you lab shows your creatinine was a little bit elevated, and your doctor told you, I think you may be dry and you may need to drink more water. Perhaps the doctor is right, and especially if you're not drinking water, we live in a hot state. So when you repeat your lab test, and if you by drinking enough water and your lab remains abnormal, then something is abnormal. But if it corrects to our expected normal value, then the doctor is right, and you are right. So again, it depends. So you should drink fluids to the point that you don't feel thirsty, and that's the bottom line. And as your CKD progresses, I'm talking about CKD 4 and 5, and then sometimes there are some electrolyte changes, like sodium levels change a little bit. Some situations we're going to tell the patient to drink less water or more water. It's just a specific situation, but in general, drink until you feel thirsty.
Hmm. And then related to that, and Patrick didn't ask this specifically, but I'm kind of curious, the choice of beverage, right? I mean, so maybe you don't have to drink necessarily a lot of water, but if you have the choice of drinking, a Coke or water or coffee or water, is there a benefit there?
Well, you're raising and opening a whole
Okay.
other topic here. In general, water is best. Water is best because soda unfortunately has many chemicals that will cause a whole bunch of other metabolic changes that you don't want to have in your body. More kidney stone risk, more diabetes risk, weight gain, and the same for beer or the same coffee. 1 or 2 or 3 cups of coffee a day, depending on your habits, is completely okay. But if you're going to overdo, then it will cause other things in your body. Drinking water may not be appealing for many of us. Sometimes getting some fruit, just squeeze lemon or get some fresh strawberries or some cucumbers, some sort, just to give a little bit of flavor. You can use also those approaches.
Excellent. Okay. Um, Well, it looks like we don't have any other questions. So with that, and we are at time. So I really appreciate it, Dr. Barrantes. Again, I always tend to learn more. You did mention about diet, and I would just like to refer everyone to our previous event post. We had an excellent presentation about cooking and kidney disease and ways to have very delicious and healthy meals that are kidney friendly and heart friendly as well. So there's multiple benefits to a kidney friendly diet. So we have that post. It's still on our web page, or excuse me, on our Facebook page. So feel free to go look at that if you're interested in suggestions about diet and how that might affect your kidneys. And again, if you're interested in all the various activities we have going on this month, please visit our Facebook page. We have our posts there with regards to the pickleball tournament, the middle and high school competition, our launch of our support group for individuals with or at risk of kidney disease and their family and caregivers, as well as the next kidney talk, which we'll be having on Wednesday, March 16th. And what are you got to be kidding me. And what are we doing that affect our kidneys and potentially negatively? So please join us for that. So again, thank you very much, Dr. Barrantes, and everyone for joining us. And we'll see you all in a couple weeks. Thank you.